Welcome back to Nico's Perioperative. You know, as anesthesiologists, we're always looking for ways to improve how we conserve blood.
Absolutely.
And today we're diving deep into acute normovolemic hemodilution.
ANH.
ANH, yeah.
Yeah.
To see how it works as a blood conservation strategy. Because staying curious makes all the difference.
It really does. Especially with a technique like ANH where there's so much nuance in how and when we use it.
Okay, so first things first. For anyone who might need a refresher, what exactly is ANH?
Well, it's a pretty simple idea, really. We're intentionally lowering a patient's red blood cell concentration before they lose blood during surgery. So that way, when they do bleed during surgery, each milliliter they lose has fewer red blood cells in it.
Right, so it's like we're diluting the blood they're going to lose, but we're doing it ahead of time.
Yeah, exactly.
But we're not just letting their blood volume drop, right?
No, of course not. At the same time we're taking out blood, we're replacing that volume with IV fluids, usually crystalloids or colloids, to maintain that normal blood volume.
Hence, the normovolemic part.
Exactly.
And then later on, we can reinfuse that blood that we collected.
Exactly. It's basically like having a personalized blood bank right there in the OR.
That's a great way to put it. So I'm guessing this isn't something we do for every patient. What makes someone a good candidate for ANH?
You're right. Patient selection is really important. The biggest factor is how much blood loss we expect during surgery. We're usually talking about cases where we anticipate the patient losing at least, say, 500 to 750 milliliters of blood.
So like big orthopedic cases, maybe some cardiac surgery.
Exactly. Those are some perfect examples where ANH can be really helpful. And of course, the patient needs to have a good hemoglobin level to start with.
Right.
If they're already anemic, ANH isn't going to be appropriate.
That makes sense. So how do we actually do this? How much blood do we take out, and what does the procedure look like?
Well, we use a formula to figure out how much blood to withdraw. It takes into account the patient's estimated blood volume, their starting hemoglobin, and what hemoglobin level we're aiming for after hemodilution. Most anesthesiologists shoot for a hemoglobin of 8 to 9 grams per deciliter.
Okay. And how do we actually collect the blood?
We use special blood bags that have citrate in them. That's to prevent the blood from clotting. And it's important to gently agitate the bag during collection just to keep the platelets from clumping together.
Okay, so no shaking it like a protein shake.
Right, exactly.
So what about storing the blood once we've collected it?
Typically, we store it at room temperature in the OR for up to 8 hours.
Right.
But sometimes, if we get approval from the blood bank, we can refrigerate it for up to 24 hours.
So we have some flexibility there. And when do we decide it's time to reinfuse the blood?
We usually wait until the major bleeding has stopped, or if the patient's hemoglobin drops to about 7 or 8. But like with everything in anesthesiology, we're always monitoring the patient and adjusting our plan as we go based on their individual needs.
So if they start showing signs of instability, we can reinfuse sooner.
Yeah, exactly. And we always reinfuse the units in reverse order of collection. That way the patient gets the freshest blood components first.
Gotcha. That makes sense. You mentioned earlier that patient selection is really important. Are there any specific situations where we wouldn't want to use ANH?
Oh, yeah, for sure. We want to be extra cautious in patients with certain pre-existing conditions.
Okay.
Like someone with heart problems.
Right.
Their heart might not be strong enough to handle having less oxygen carrying capacity in their blood.
So they might not tolerate that lower hemoglobin level.
Exactly. And patients with kidney problems might have trouble getting rid of all that extra fluid we're giving them.
Oh, yeah, good point. And of course, we already talked about not using ANH if someone's anemic.
Right, exactly. It all comes back to choosing the right patients.
Carefully weighing those risks and benefits for each person.
That's it.
So I'm curious how effective ANH actually is. I mean, we've talked about the idea behind it.
Yeah.
But does it actually make a difference in whether or not patients need a blood transfusion?
That's the big question, isn't it?
It is.
And the research on ANH can be a little tough to sort through.
I can imagine.
There are lots of different studies out there. And they look at all sorts of surgeries, different ANH protocols, and different control groups.
So it's not a simple yes or no answer.
It's not, but generally the research seems to show that ANH can be a helpful tool, especially when we combine it with other things we do to minimize blood loss.
So it's not like a magic bullet.
No, it's more about using a bunch of different strategies together.
Having a multi-pronged approach.
Exactly.
Okay, so what about safety? We're basically inducing a controlled state of anemia here. Are there any concerns we need to be aware of?
The main concern is the potential for what we call dilutional coagulopathy.
Dilutional coagulopathy.
Yeah, basically when we dilute the blood, we're also diluting the clotting factors.
So there's a theoretical risk that the patient could bleed more.
There is, but luckily most studies haven't shown any significant increase in bleeding complications with ANH.
Okay.
We always monitor for any signs of coagulopathy, and we can always give clotting factors or other blood products if we need to.
So it's a risk we need to keep in mind, but not necessarily a reason to completely avoid ANH.
Right. It's all about having a plan and being ready to change our management based on how the patient is doing.
You know, one thing I've always wondered about is how we actually make this work in practice. I mean, ANH seems like it has a lot of moving parts. What are some of the key things for anesthesiologists to think about if they're considering using ANH?
Well, teamwork is super important.
Okay.
Everyone needs to be on the same page. The nurses, the perfusionists, the surgeons.
Good communication is key.
It's essential. And we need to have the right equipment, the special blood collection bags, a way to accurately measure the blood we're taking out, a mechanical agitator.
Right, to keep that blood from clotting.
Right.
And of course, all the usual monitoring equipment to make sure we're keeping a close eye on the patient's vital signs, hemoglobin levels, fluid status.
Yeah, all of that. We can't just set it and forget it.
Right.
It takes constant monitoring and being proactive.
And I imagine there's some logistical stuff to consider too.
Yeah.
Making sure the blood is labeled correctly, stored properly, avoiding any mix-ups with donor blood.
Absolutely. Clear communication and careful documentation are critical.
Yeah.
We have to be really careful to avoid any mistakes.
So shifting gears a bit, I'm curious about how cost-effective ANH is. We've talked about the clinical benefits.
Yeah.
But does it make sense financially as well?
It actually does.
Really?
ANH can actually be more cost-effective than using donor blood.
Interesting. How so?
Well, think about all the costs that come with donor blood. Testing, processing, storage.
Right.
We're basically eliminating all of those costs when we use the patient's own blood.
That makes sense.
Yeah.
And I mentioned there are also savings from having fewer transfusion-related complications.
Exactly.
Because those can lead to longer hospital stays, more interventions.
Exactly. So ANH can be a win-win. It's better for the patient,
Right.
and ND, it saves the healthcare system money.
That's great to hear. You know, one thing I've always found interesting about ANH is how it changes the way we usually think about blood management.
Yeah.
I mean, we're so used to reacting to blood loss, giving a transfusion when the hemoglobin gets too low.
Yeah.
But ANH is all about being proactive.
Right. It's a different way of thinking.
It is.
We're anticipating the blood loss and taking steps to lessen the impact before it even happens.
So it's about being more strategic and less reactive.
Exactly. And it means really understanding the physiology involved, the risks and benefits of the technique.
Well, before we wrap up our deep dive into ANH, I want to touch on some of the ethical considerations. Like any medical intervention, ANH raises certain questions that we need to think carefully about.
Absolutely.
It's not just about the technical aspects, it's about the ethical implications as well.
It is.
For example, one of the most important principles in medical ethics is informed consent. How can we make sure that patients understand what ANH is all about before they agree to it?
That's a great point.
Yeah.
We have a responsibility to give patients clear and thorough information about the procedure, what the potential risks and benefits are, what the alternatives are.
Right. It's not just about having them sign a form. It's about actually talking to them, answering their questions, addressing their concerns.
That's right. And some patients may have the wrong idea about ANH.
Yeah.
They might be worried that it's dangerous or that it'll make them weaker during surgery. So we need to be ready to address those concerns and give them reassurance based on the evidence we have.
And to really emphasize that the goal of ANH is to keep them safe and healthy.
Exactly. And we always need to be mindful of the potential for coercion. Especially with patients who might be more vulnerable, like those who are having life-saving surgery. We should never pressure patients into making a decision that they're not comfortable with.
Right. Their autonomy is paramount. We need to respect their wishes and make sure they feel empowered to make an informed choice.
Absolutely. And this connects with the principle of beneficence, which is acting in the patient's best interest.
Yeah.
ANH can be beneficial in lots of cases, but it's not always the best choice for every patient.
Right.
We need to carefully weigh the potential risks and benefits and recommend what's truly best for each person.
So it's a balancing act. promoting the patient's well-being while also respecting their right to make their own decisions.
Exactly. And that's what makes medical ethics so challenging and so rewarding. It's not always clear-cut. We have to deal with complex issues and make tough calls.
I think that's a good place to leave it for now. We've covered a lot today.
We have.
From the basics of the A&H procedure to the ethical considerations that come with it. It's a really complex topic, but this conversation has been really helpful in highlighting how important A&H is for conserving blood.
I agree. And A&H is a technique that's always evolving as we continue to learn more about it.
That makes sense. Speaking of evolution, what do you think the future holds for A&H? Where do you see this technique going in the next few years?
I think we'll see more and more research looking at how well A&H works in different kinds of surgeries and in different groups of patients.
Yeah.
We might even start seeing A&H used outside the hospital, maybe by paramedics, for trauma patients who are bleeding heavily.
That's a really fascinating idea. Bringing A&H into the field could really save lives in those critical situations.
Yeah, definitely. And as more people become aware of A&H, I think we'll see more hospitals start to include it in their blood management programs.
I hope so. I think A&H has the potential to completely change the way we think about blood loss and transfusions.
I agree. It's a great example of how we're always trying to find ways to improve patient care and get better results.
Well said. Well, as we wrap up our deep dive into A&H, I want to leave our listeners with one final thought. A&H is a really powerful tool.
It is.
But it's just one part of the bigger picture. To be really effective at conserving blood, we need to use a variety of strategies.
I completely agree. It's about combining careful surgical techniques with a deep understanding of each patient's individual needs, and of course, always staying up to date on the latest evidence-based practices.
Exactly. And as always, stay curious.